Mr. Speaker. Mr. Speaker, 7 years ago, in March of 2010, the Affordable Care Act was signed into law after a 2-year process of hundreds of committee meetings, exhaustive markups, which I personally participated in, floor debate that went on for days, and again, back and forth between the House and the Senate. Since that date, despite the, again, bitter criticism by the Republican majority, law went into effect, there have been 60 votes to repeal the Affordable Care Act. And up until this morning, they have always, the majority has always begged the question about what is your replacement. Again, just last week we heard rumors that there was a replacement, that the Speaker actually had drafted a bill. Well, with scenes that looked like it was out of the Blair Witch Project, we had members of Congress going around the Capitol, opening doors with cameras, doing live streams and live coverage, again, to empty rooms and denials that there actually was a bill that anyone could actually take a look at. Well, as I said, this morning we've now been told that there is a bill that has been filed, which tomorrow will be marked up and voted out of committee with not one single public hearing and, incredibly, with no analysis by the Congressional Budget Office, which any bill that has any impact on budget, whether it's a tax bill or a spending bill, has, a matter of course, for decades always been the case. And there is no measure which contains more significance in terms of a congressional budget analysis than reforming the health care system of America, which constitutes about 15 to 20% of the American economy and affects the lives of tens of millions of Americans. Well, from what we've seen so far, it appears it's a good reason that the folks wanted to keep the bill a secret. Again, the basic fundamentals of the Affordable Care Act is built on two pillars. There was an expansion of Medicaid, and there were subsidies based on income for Americans to be able to buy insurance through Marketplace. In the state of Connecticut, where I come from, we have cut the uninsured rate down to 3.6% from approximately 9% when the bill was signed into law 7 years ago. What this bill does is, again, it just basically decapitates the Medicaid expansion, so about 11 million Americans are going to have their health care coverage threatened. Those are not just, people on entitlement programs. We're talking about working Americans. I know a farmer in my district who almost lost his foot from a chainsaw accident, who thanked me the other day that he had Medicaid to cover the costs of his hospital coverage. And again, the subsidies which allowed people to buy plans on the insurance marketplace. Well, they basically, as I said, decapitate Medicaid, and they also convert the subsidies from an income-based system to an age-rated one, which means that basically a well-to-do person gets the same tax credit that a poor person or a single parent has. A conservative economist, Avik Rod, just a few minutes ago, issued a statement saying, expanding subsidies for high earners while cutting health coverage for the working poor sounds like a caricature of mustache-twirling, top-hatted Republican fat cats. Again, you cannot imagine a more Robin Hood in reverse than a plan that does what this tax credit change encompasses. And again, the list goes on in terms of some of the really just outrageous proposals that this new measure contains. For seniors, again, the Affordable Care Act contracted the age rating from 1 to 3 to 1 from what existed before was about 6 to 7 to 1. In other words, a senior, an older person, could be charged 7 times the same rate as a 20-year-old. Again, the Affordable Care Act reduce that span to 3 to 1. This bill expands the span again to 5 to 1, which the Americans ARP has already issued a statement saying is nothing more than an age tax. It's charging people based on their age, which is nothing that any human being can control. It also, again, rolls back tax break or tax increases, slight tax increases for high-income earners, as Mr. Roy's comment indicates, and worsens the fiscal solvency of the Medicare Trust Fund, reduces its 4 years. Again, Catholic Health Association has come out today criticizing this proposal. Again, just an incredible array of stakeholder groups all across the country are already speaking out. The fact that this measure is going forward in committee tomorrow morning, less than really 24 hours for the American people to have even a glimpse in terms of what is being proposed without an analysis in terms of a budget score, again, is just an abuse of the legislative and democratic process. Mr. Speaker, again, we have seen an outpouring of Americans over the last 2 months at town hall meetings. I've had 4 of them. People telling heartfelt stories about how the ACA helped them. Yes, we can improve the law. There are many ideas that we can work together on. That's what we should be focused on, not butchering the law, which this proposal seeks to do. I yield back.
For what purpose, the gentlewoman from North